Well, there has been a surge in COVID cases in New South Wales as Christmas parties and holiday celebrations spur on transmissions. Let's go live to Kenny Heatley. He's in Newcastle, north of Sydney. Kenny, we've seen a cluster emerge there. The case numbers are high today, but all the other stats are pretty good. This is what learning to live with COVID looks like.
It is, people coming forward for their booster shots as well at the moment, a full vaccination rate above 93%. So that's holding the hospitalisation and ICU rates at bay. However, there's been a big jump in the daily case numbers today, and these figures have been released in the past 20 minutes or so. 804 cases in New South Wales today. That's a jump from 536 from the previous day. And the reproductive rate yesterday rose to 1.43, which is a 4-month high, meaning that for every 100 people that become infected in New South Wales, it gets passed on to 143 people. So you really want that below zero to get a declining trend. So it is definitely on the way up. However, the most important figure is the hospitalisation rate, which actually fell from yesterday. 168 people in hospital, and the ICU rate fell from yesterday as well, down from 24 to 21, and there was one reported death as well. We're going to get a bit more of an update from New South Wales Health at 11 o'clock, but the fear is that as we're seeing these parties at the end of the year, the Christmas parties, the end of year gatherings, and people come together for that, these cases are going to be continuing to rise despite the hospitalisation rate. And with Christmas, Laura, so close, you don't want to be having to isolate for 14 days or so if you do pick up coronavirus. So that could be an issue for some people as well.
Yeah, let's hope that does not happen. Kenny, a cluster is growing in Newcastle where you are at that drive-through clinic at the moment. What's the turnout been like this morning?
We've been here since 8 o'clock this morning when it opened, and this particular clinic has extended their testing hours to 8 p.m. to deal with the load. I'll just get Shane, my cameraman, to just do a bit of a zoom around here. It's absolutely packed. Many people coming forward here, and it's because of this super spreader event that has occurred at the Argyle House nightclub on the 8th of December. Cases there have grown to at least 84, but we're going to be getting the latest figures from New South Wales Health a bit later on, so that number is expected to rise. And there's other hotels, other restaurants here, including Flanagan's Hotel, just about 6 minutes down the road, which has been listed as an exposure site on February 10 as well. And there was a medical ball with the University of Newcastle at the exhibition centre here, about 100 people. So we've got hundreds of people and their families in isolation, and they're waiting to get these negative test results back. And also the Newcastle Knights, some players have been impacted there, and all Newcastle Knights players are currently isolating, waiting for negative results as well, because it's been reported that a few household contacts of a few players were at the Argyle House nightclub. So it is a bit of a concern here. We are waiting from New South Wales Health to confirm that people here do have the Omicron variant. They are concerned that it is that variant because the Argyle House transmission event occurred after people who were infectious came from a Sydney Harbour party boat cruise on the 3rd of December where the Omicron variant was detected. But that genomic sequencing, Laura, is currently underway.
Kenny, thank you.